Thank you, Bonani, and it's really fantastic to have these discussions at an academic institution. It's one of the ways that we're trying to do transformative research that's going to lead to change, having these discussions with stakeholders right at the beginning. So just to correct Bonani maybe on one thing, the project's not set in stone yet. That's why we're having this discussion today. So I'm completely out of my comfort zone here with the things that I'm going to put up that us as academics together with NAMC and Vanderpump came up with, because I think we're missing the point in a few if I listen to all the discussions today. But I also think there's a few things that we maybe have correct. But the idea is really to hear from everybody, and we're not going to have enough time. But this is the start of that discussion. So I just want to go back to the bigger project, because it's really about interdisciplinary. And I think everybody here understands interdisciplinary. If I listen to the industry, to the Department of Agriculture, and to the academics, we know the need for addressing these complex issues from all sides. And it's not easy. I'm not going to say this is easy to do. It's really tricky to answer complex system issues around food also. But one of the things we really want to do is really co-develop. And we've talked a lot about One Health using that approach, and I'll say something more about that. Although this is a project, we function around projects that has a start and an end. This shouldn't be the end of the conversation. Esty mentioned when she introduced herself that we link this to our Arua food system, Sustainable Food System Chair, which is based here at Future Africa. And improving African herds is part of that bigger vision. And this is not something that's going to disappear after the project. So we can think a bit long-term, although we have some constraints with the project, but we can think long-term in what's best for the country. So I didn't Google the One Health definition, and I always have to show this because I'm currently the chair of the One Health high-level expert panel advising the quadripartite. And this is what our foundation for One Health at the university and also in South Africa, Mishak mentioned the One Health initiatives that we use as a base. And I'm not going to go through it in detail, but I think one thing, we always talked about multiple sectors and disciplines, but there's another word in here, communities. Now, communities is the policymaker. That's why it's so great to have Department of Agriculture here, public, NGOs, private. I think online, the Farmers Association was online. You know, we have to have all those role players in this co-development. We're not there yet today. This is just the start. There's several people missing around the table. But I also want to show this, because if we talk about a One Health approach, and this is true for any approach, there's certain things that we always need to take into account. Equity on several levels is extremely important. Socio-political parity, where we really need to look at engagement of communities and marginalized voices to really understand what we're doing. Socio-ecological equilibrium, all living things have value. And we as humans need to take responsibility to fix some of these problems that we're creating. Otherwise, there's going to be nothing left at some point. And then getting to transdisciplinarity, and where we really need to look at modern and traditional forms of knowledge. I'm a bat virologist, but really functioning in a transdisciplinary space where we work with the cattle herders, we work at dip tanks because we're looking at spillover. And most of my knowledge comes from those environments and sitting under a tree and listening. So we really need to go back to bring that also into our conversation. So just something broad on One Health that I just wanted to bring into this picture. So like I said, I'm completely out of my comfort zone here, but we were thinking in the university and between our stakeholders on some questions that we want to address around cattle and pork food value chains. And we're looking at a 20-year period because we want to look at change. We're bringing in diseases, and I think this adds value. There's been a bit of work done, separately on pork and on cattle, but we never really looked at bringing in things like foot and mouth, cysticercosis, African swine fever, over time into these analyses and see maybe if we can say, this is what's causing it, or this is where we can intervene. So this is really open for discussion. It's specifically looking at the relationship between cattle and pork, protein consumption, livestock ownership, agricultural practices, and occurring of natural disasters, which is also diseases. And really looking at research questions on production, marketing, transformation, and purchase of food overall, consumer practices, resources, and everybody that's involved in this process. So although we're looking at pork and meat, pork and beef, we want to look at, sorry, that was not on purpose. Okay, wrong word choice. So we really want to look at all consumer preferences, and this is where we're linking it a little bit with crops and everything also, because we have that data and we will look at poultry and all of that, but we need to focus on something for the project. So the team, you've heard University of Leeds, University of Wageningen is involved, all the stakeholders, but then at the University of Pretoria we really brought in expertise from several faculties. And you may think this is how we always do things. No, it isn't. We usually work very siloed. So we're really bringing in people that know the veterinary side, Centre of Viral Zoonosis, although the name say Viral Zoonosis. We're really broadening the mandate of the centre, looking also at infectious diseases of animals. So it's not just that. Our Faculty of Natural and Agricultural Sciences, and I think here specifically economics, I heard that word quite a bit today. And people like Donnie, and some of his postdocs that's really been functioning in this space and bringing that expertise into it. Consumer science, we have a lot of data in our consumer science departments. Animal sciences with Esty there at the back, who's going to look with Kaylee at the pork industry. And then we have veterinary sciences. I see Nene is here, and there's Dr. Renane also from animal production. So we're really bringing in all this expertise. And then just maybe something about Future Africa. It's not just a conference venue or a campus. So this is a new platform that we established for transdisciplinary research, specifically to strategically look at projects that we need to do across faculties, across stakeholders. And I'm in a chair in One Health in Future Africa, so usually I end up trying to facilitate these projects within the university. So now I'm going to put a lot of things on here, and I think as we go through it, put crosses, or if you think it's a good idea, or if you think we need to relook at some of these. But we really want to look at this pork and food system changes over time and how it can create unintentional disease risk that also have a negative effect on food security as well as health. We call it rural and urban populations, but I was thinking today this is probably informal and formal markets is probably the correct words there. I'm a virologist, so the terminology may be completely wrong, but we can discuss that, and specifically looking at 3 diseases that we think, and we also heard, influence these sectors. We want to map it and then see if there's changes. We want to identify what aspects of the food system transition are maybe creating these unintentional infectious disease risk, and where we can show if there can be interventions. We need to link all of this back to diet diversification because you've seen what the overall project is, so that's why you will hear the word diet diversification quite a bit. That will be maybe in 2 years. We will look at it more broadly and see if that's an option. I mean, there's different movements. There's people that say we must completely stop eating meat, but what is our reality in South Africa? We want to look at how small-scale farmers adapt to more market-orientated production while they have to think about risk of transmission of diseases through the products produced on farms because they are feeding into a much broader consumer group. And from my understanding from the discussions we had, we're not really understanding exactly how this is currently happening and the extent, and that might be something that we can investigate. And then we want to look at diet diversification and in the long term, how we can maybe use that as a way of improving the infectious disease situation. So there's lots of specific questions that we thought about. I don't think we can address all of them, but this is the type of things that we're thinking of. The way we want to design this currently is a paper-based exercise, let's say for the next year, looking at what data we have, what questions we can answer, what gaps we can look at under an evidence and thesis framework, where we really go through all the data, see what we have, identify the gaps, and then there's the option of doing directed field studies where we're missing information in the future in these projects. For instance, looking at consumer preferences, focused on diet transition, but specifically including cattle and pork, changes in production of certain field crops. Here we brought in the soybean, specifically because Zambia is part of this project, and because of the import link with feed, and that's why there's some of this aspect also in here. How did small-scale farming influence beef and pork over the past 20 years? How does the place of marketing and movement of animals between these urban and rural export and import changed over years? Location of abattoirs, feedlots, marketing places, all of that. How did beef and pork production systems change? Same question actually. Has there been a change in the marketing channels of beef and pork? And how did beef and pork prices compare with other prices to basically justify some of these changes, some of the economic issues that we're bringing in? I think, was it Johan that said everything is driven by the money in the end, and the decisions also. So we really need to understand that. And then trying to bring in the environment by looking at agricultural changes and intensification in the past 20 years. And when I listened to Mishak, we can actually bring in climate also here, and how that influenced some of these changes. And then really summarize how the incidence and distribution of diseases changed in 20 years in South Africa around these 3 diseases, and trying to bring all these other factors together. So first just getting all this information, and then trying to use some fancy modeling approaches to do something with it. And that is the expertise that's coming from Leeds, that's coming from some of our departments in the university. It's really analyzing the data and see what we can get from it. So I've talked about the evidence synthesis. I'm going to end with that because Bongani, I actually decided I will talk shorter, and then we still have time for discussion and questions. But this is some of the things that we were thinking of. If you're sitting here, what is the key driver of change in the sector? I hope we can maybe summarize it to 1 or 2, or are they just too many? Identify key evidence gaps associated with that driver of change. Are we of opinion that certain things are relevant, or do we have scientific evidence? Because in the end, we need to go back to scientific evidence. I think Mishak also said that. If you want to go to war, you need the scientific evidence. Do we have that? Or is this, we all see it on the ground, but do we actually have the evidence to back up some of the decisions and things that we see changing? And then what existing data do we have to address these research questions or gaps? You know, where do we need to invest to really understand? So I'll give over, maybe Donnie is one of the key people leading some of the work. I don't know if you want to add a bit on economics, because I'm not a very good speaker on economics, so I'm not even going to try. But if there's any other people also from the pork side, Esti, maybe if you want to add to that. Thank you. And then we will do discussions. Yeah.